guys. Let's talk today a little bit about the preoperative education of a surgical patient. So education of our surgical patients is super important. I'd have to say the most important part of patient education is increasing our patient safety. But in addition to that, education is going to prepare the patient and the family for what will come, which most definitely reduces anxiety and fear. When our patients are properly educated, this can really decrease the length of stay they're in the hospital. It can decrease any post-op issues and can most definitely promote a quicker healing time. Patient education occurs during the entire surgical process from admission to discharge by all of the perioperative team members. However, the majority of the education occurs before the surgery with the pre-op RN. So just to bring home the importance of patient education a little bit further, it really increases patient autonomy. It makes patients feel like they're in control of their own health and well-being. It helps to answer any questions that the patient may have, and knowledge is definitely power for patients. This should be included within the informed consent process. And guys, patient education should begin with the provider. Make sure you check out the specific lesson on informed consent for more details. So for me personally, being a perioperative nurse for quite some time, when I think of preoperative patient education, I like to break it down in my mind into the different components that the patient is going to go through. So like I mentioned a few slides ago, the preoperative nurse will do the majority of the education, but they're going to help the patient understand what is going to occur in not only the pre-op area, but also in the intraoperative area and in the postoperative area after surgery. So the preoperative nurse is going to first teach the patient about things that are critical before surgery. Patients and families like to be educated on their procedure specifics, like how long the procedure is expected to take and what they can expect afterwards. It is okay to tell patients that you will check with the provider for the best answer to these questions, because trust me, they will hold you to what you say. A super important part of preoperative education is the NPO status of patients. This is critical to the surgical patient to prevent aspirations, as this is a risk when patients go under anesthesia. Please know that preoperative education should start before the day of surgery, especially things like when to stop eating or drinking. Also, the preoperative nurse will discuss, with direction from the provider, the patient's current medications and if and when to stop them. So just like NPO guidelines, the patient should have this education prior to the day of surgery. So continuing with some more specifics of preoperative education, the patients are often given instructions as far as preps that may be necessary before their procedure. These can include things like possibly a bowel prep, if they're having a colon resection, or even bathing with a specific type of soap if they're having an orthopedic procedure. Obviously, this is something that the patient will do before surgery. So as the preoperative nurse, you will want to confirm with your patient that these things have been completed. So you'll also teach the patient about their IV and what that will entail, any testing that they may require before the procedure, like possibly a pregnancy test or an X-ray, and also the type of anesthesia that they're going to have. Education regarding anesthesia is typically discussed by someone from the anesthesia department. So the preoperative nurse will begin to explain to the patient what will occur during surgery or when they are brought into the operating room, OR. The circulating RN will continue the education and explain to the patient that they will protect their privacy and safety and dignity during the procedure. I found that explaining what will happen in the OR, applying monitors, the timeline of anesthesia before the patient is brought into the OR helps to ease anxiety. And finally, we want to educate our patients as far as how we will communicate with their family during the procedure. Explaining to the patient what will occur after surgery preoperatively is super important because after anesthesia, patients do not tend to have the best memory or comprehension. So teach your patients what they can expect in the post-op area, like if they may wake up with any lined drains or catheters. It's not a good surprise. The plan for pain control or pain management, and this is a huge question mark for patients. They want to know about this, and the steps that will be taken to get the patient discharged or on their way home. So the discharge details. So as always with patient education, you're just going to want to really encourage your patients to ask questions, especially if they are unsure or confused about anything related to the surgery. It is also a great idea to encourage your patient to repeat what they learned in a subtle way to promote their understanding. Finally, we want patients, if they are okay with it, to involve their family or their support person with education for support after the procedure. Okay, guys, the nursing concepts that can be applied to the preoperative patient education are most definitely comfort, coping, and safety. Remember, surgery can be very scary for patients, so education will help them cope with the situation as well as comfort them. Education of the surgical patient is first and foremost for their safety. All right, so some key points for preoperative education. The goal is always to increase patient safety by preparing the patient, decreasing anxiety and complications to help increase healing time. The patient education is very important because it increases patient autonomy and decreases any knowledge deficits. So to make preoperative education a little less daunting, we break the preoperative education down into the different sections: pre-op, intra-op, and post-op events. So with pre-op, you explain the procedure specifics, MPO status, medications, any preps they may require, diagnostic tests before the procedure, insertion of their IV, and the anesthesia type. As far as during the procedure, explain the role of the perioperative team members, especially the circulating RN, the application of monitoring devices that will be applied when they go into surgery, the events of the anesthesia administration, and how and when their families will be updated. Finally, guys, explain the events that will occur after surgery, their expected length of stay, if they will wake up with any drains or catheters, help them understand their pain management plan and the events that will lead up to their discharge home. Okay, guys, I hope you enjoyed this lesson on the preoperative education of a surgical patient. Make sure you check out the resources attached to this lesson as well as the rest of the lessons in this course. Now go out and be your best self today, and as always, happy nursing.